after the surgery?
I'm a little tired right now.
Well, it's common for all of the patients after the surgery to feel tired, so you're nothing to worry about yet. But let me check your surgical wound and see how's it doing. Ew, that's nasty.
Excuse me? What is nasty down there?
Your wound, no, I mean your surgical wound. There's some swelling and you have a fever as well. Let me check if it's hurt.
Ouch, that really hurts. Stop!
Well, did you ask her? So you appear to have an infection. We have to do some checkup on that.
Am I dying? I'm too young to die. What's happening to me, Maris?
You'll be fine. I just have to draw some blood work to find out the cause of the infection.
Okay.
Well, that was the last patient of the day.
Sweet. Now I can go back to my room and enjoy some of my delicious Dr. Pepper.
You're not going to wash your hands after visiting all the patients?
See it clean now. You don't need to waste clean water. They're running out of it, and they won't make any more Dr. Pepper if they're running out of clean water. Oh, remember to bring the blood sample to the lab for the testing. And on the way back, can you get me some Dr. Pepper?
Well, what about the money for the Dr. Pepper?
What about it? You have some, don't you?
Unsanitized and cheap. How did he become a doctor?
You saying something?
Nope, nothing.
Then hurry up and tell the lab tech lady that I'll buy her lunch if she can hurry my result up.
Okay. Here's the blood sample from Dr. Pepper. He says he will buy you lunch if you hurry up, even though he won't pay for his heavenly delicious Dr. Pepper.
That cheap doctor. Probably get me like a lunch bowl or something. But hey, probably can't pass up some free food, right? Okay, here are your results.
What took you so long?
Do you want good results or do you want crappy results?
I'm sorry, so what's the result?
Well, I analyzed the blood sample and I suspect it to be Vancomycin-Resistant Enterococci. I started by growing a culture in blood agar to see which bacteria were present, and then confirmed by testing for drug sensitivity, specifically for vancomycin. It's confirmed to be VRE infection. Bring Dr. Pepper the results so he can follow up with immediate treatment. And please tell him to wash his hands before he buys me any kind of food.
I will try, but there's no promise.
Especially with VRE infection, you have to make sure he's practicing proper hygiene and is wearing gloves when coming in contact with infected patients' body fluids. You don't want him to transfer it from patient to patient.
Alright, I will try, but I'm not his babysitter.
What taking you so long? My grandma would have been faster than you.
Do you want good results or crappy results?
I'm sorry. So what's the result?
It's a VRE infection.
Well, at least I know that I'm not gonna get it because I'm healthy enough. I really need to wash my hand.
Yeah, and the lab tech lady wants you to wash your hands before you buy her food.
Then I won't wash my hand then. I'll save some money. Well, I'll go over the patient room and explain it to her. You go get the lab tech lady and bring her to the room.
Dr. Pepper, am I dying right now?
Maybe you are.
No, she's not.
Well, just kidding. But you do have Vancomycin-Resistant Enterococci.
What are those? Am I dying still?
Well, you will die eventually, but your time hasn't come yet. This is a treatable disease, and you'll be fine. Enterococci are round-set bacteria that actually live in your gut.
Ew, there are bacteria in my gut right now?
Yes, there are. Enterococci are normally good bacteria. However, VRE, not so much. They can be transmitted through direct contact with any contaminated site, especially the blood and feces of an infected patient. The entry could be through an open surgical wound, like in your case, through skin by a compromised needle inserted to deliver medication, or catheters.
Well, they come in your bloodstream and circulate through your body. They are not contagious otherwise. They often attack immunocompromised patients such as yourself, and VRE infection is an opportunistic disease. It can cause any kind of infection, but in your case, it's a surgical wound infection. You have some fever, redness, and pain near the wound. It can be fatal if we don't treat it right away, but since we know it now, we'll follow up with immediate treatment. You will take daptomycin 4 mg per kilogram IV once every 24 hours for 7 to 14 days, and the nurse will help you administrate it.
So I'm not gonna die today?
No, not yet.
Thank goodness. What's up, dog?
This one is going
I'm sorry, so what's the result? You can't read it.
I know. Bring Dr. Pepper the results so we can follow up with immediate treatment.
Oh, oh no, hold on.
So what is it like? We're creeping on you.